Welcome to B24 Media, your gateway to the future of business news. In today's fast-paced world, staying ahead means staying informed. That's where we come in. At B24 Media, we specialize in delivering live-streamed business news, empowering professionals, entrepreneurs, and decision-makers with the knowledge they need when they need it. Our platform is more than just news. It's a 24/7 pulse on the global business landscape. From breaking market trends and live earnings calls to insightful analysis from industry leaders, B24 Media puts the power of information in your hands, live and unfiltered. Whether you're tuning in on your morning commute, preparing for your next big pitch, or simply staying ahead of the curve, B24 Media is your partner in progress. Because in business, timing is everything. And with us, you'll never miss a beat. B24 Media, where business meets the future, live.
Kidney stones: causes, symptoms, management, and prevention. Kidney stones are definitely no walk in the park, but there are ways to manage the pain and discomfort. Learn more about what you can do. Kidney stones: mineral concentration. Kidney stones develop when minerals and salts in the urine become concentrated in the kidney and form pebble-like lumps, usually made of calcium and oxalate or phosphorus. A stone may eventually move out of your kidney and travel through your ureter, bladder, and urethra. The ureter is the tube that drains urine from the kidney to the bladder. The urethra is the tube through which urine travels on its way out of the body. 80% of stones include calcium, but the body can also produce other types of stones, including uric acid, struvite, and cysteine, an amino acid that helps build protein stones. The most common contributing factor to kidney stones is dehydration, according to Washington University School of Medicine in St. Louis. Urine is a solution, but with dehydration, there may not be enough fluid in the urine to dilute the minerals and salts that develop into stones. The cause of kidney stone pain. It's not the stone itself that causes pain. In fact, if a stone can stay in the kidney or pass through the ureter without causing a blockage, there may be little or no pain. But when a stone moves around in the kidney or gets stuck in the ureter and blocks the passage of urine, the blockage can cause the following symptoms: sharp stabbing pain in the back or side, pain that comes and goes, nausea, vomiting, frequent urination, painful urination, blood in the urine, fever, but only if an infection is present. The smaller the stone, the more likely it will pass on its own. 80% of kidney stones fall into that category, less than 4 millimeters, but it takes an average of 31 days to happen. If the stone is 4 to 6 millimeters, it will pass about 60% of the time. If greater than 6 millimeters, the stone will pass about 20% of the time. In most cases where the stone is greater than 4 millimeters, a medical procedure is necessary. Medications include aspirin, acetaminophen, prescription pain medications, diuretics, and antibiotics. Drink plenty of fluids to increase urinary volume that may help pass the stone. Stay as active as possible. Walking helps. Your doctor may prescribe a drug that relaxes the ureter, which allows the stone to pass. Taking a hot shower or sitting in a tub of warm water offers temporary relief. WHE to see a doctor for kidney stones. Notify your doctor if you think you have a kidney stone. If you have severe pain and other signs and symptoms of a stone, get help right away. Your healthcare provider may recommend some of the measures above and may ask you to capture a stone if it passes so it can be analyzed. Blood tests can show calcium levels, glandular problems, and kidney dysfunction. A CT scan can identify a kidney stone, and ultrasound scans detect swelling of the kidney and/or the ureter, an indication that the stone is blocking the flow of urine. Under the supervision of a doctor, you might be able to treat a kidney stone at home. If the stone is too large, the pain too severe, infection is present, or there is significant bleeding, the kidney stone will have to be removed surgically or broken into fragments that can move through the urinary tract. Prevention. About half the people who have a kidney stone will never have another incident. For those who have recurring stones, the prognosis depends on the cause and on how well the patient responds to prevention guidelines. They include drinking more fluids, eating less protein, reducing the intake of salt, and increasing the intake of citrate, lemons, oranges, grapefruit, a chemical that inhibits the production of kidney stones.